Hello. I just started with a
Okay, through
Yes, good afternoon, dear students. This is my fifth class on enzyme. In the previous four classes, I have covered enzyme definition, classification of enzymes, then coenzymes, then what are the factors affecting the enzyme activity, then enzyme specificity. Then in the previous class, I have covered the enzyme mechanism of enzyme action and enzyme regulation, and also I have covered the enzyme inhibition. So all these topics are covered. Now So specific learning objectives of today's class are unit of enzyme activity. We need to learn what is the unit used for enzyme activity and describe the isoenzymes with examples and what are the clinical significance of isoenzymes. Then describe the diagnostic and therapeutic importance of serum enzymes in the various disorders. Coming to the unit of enzyme activity. So these enzymes, they are never expressed in the concentration. Okay, this enzyme is present in this much concentration in milligram or in microgram, but they are expressed in terms of activity. How much they are capable of converting a substrate to the product. So that is the activity of enzyme is measured rather the concentration of the enzyme. So there are various methods for the estimation of the enzyme activity. Okay. So what are the units we use? Okay. We use the unit Kettle, King Armstrong unit, Somogi unit, okay. Then Reitman Frankel unit, and there are other units, spectrophotometric units. Okay. So these are the units. We have to learn here about the units used for the enzyme activity. So what are the units? One is the Kettle, then King Armstrong unit, Somogi unit, Reitman Frankel unit, then spectrophotometric units. These are the different units we use for the activity of the enzymes. Now first coming to what is this Kettle. Okay. So here, in order to maintain the uniformity in expression of the enzyme activity, this IUB, okay, International Union of Biochemistry, has suggested the radial changes. Okay. A new unit was introduced called as Kettle. So what is this Kettle? Okay. Kettle denotes the conversion of 1 mole of substrate per second. Okay. Per second, the quantity of the substrate getting converted into product. Per second. Okay. It is in terms of per second. Okay. Or the mole of the or 1 mole of substrate per second, the conversion of the substrate to the product per second. Okay, so this is the Kettle. The activity may also be expressed as milli or micro Kettle. Okay, but this is less commonly used. So what is this Kettle? It denotes the conversion of 1 mole of substrate to the product per second. Now coming to international units. Okay. Some workers, they prefer to use the standard units. Okay. SI refers to System International. EU refers to the enzyme unit. Okay. Then IU refers to the international units. Different workers, they have used different units. Okay. So what is the definition of this international unit or SI unit? Okay. Here, how to define it? It is the amount of the enzyme activity that catalyzes the conversion of 1 micromole of substrate per minute. Okay. Here, it measures the activity of the enzyme that catalyzes the conversion of 1 micromole of substrate to product per minute. Okay. So SI unit or Kettle, they are interconvertible. How they are related? One international unit is equivalent to 16.67 nano-Kettle. One international unit is equivalent to 16.67 nano-Kettle unit. In the laboratory, older units are used like KA units, that is called as King Armstrong unit. Okay. Somogi unit, Reitman Frankel unit, and amylase unit. So these are the units. So first what we learned? Kettle. Kettle is what? It denotes the enzyme activity. Okay. Enzymes are measured in terms of activity, not in terms of concentration of converting a particular substrate to the product. So that is the activity of the enzyme. It is measured in different units. One is the Cattle. Cattle is what? It denotes the conversion of 1 mole of substrate per second. 1 mole of substrate is converted into product per second. Okay. That indicates the Cattle. Okay, 1 Cattle. And some purpose we have preferred to use international units, okay, or enzyme units or system international. So what is this SI unit? Okay, it is the amount of the enzyme activity that catalyzes the conversion of 1 micromole. Here it is not mole, it is 1 micromole of substrate per minute. Here it is in per minute and it is micromole of substrate is converted into product per minute. Okay. But there is a relation between this Cattle unit and international unit. They are interconvertible. Okay. If you find out the international unit, you can convert it into Cattle unit. So how to convert? If you found out international units, you can convert it into Cattle unit just by multiplying into a factor called factor 60.67. Okay. 60.67. What are the other units used for the enzyme activity? King Armstrong unit. Okay. Then we have a Frankel unit and amylase unit. Now coming to the iso-enzymes. Okay. By this figure, see what is the difference? All are 1 rupee coin. Okay. But there is a difference. Okay. This is manufactured in the 2005. Okay. This is in 2000 and this is in 1997 and this is manufactured in 2002. But their function is same. Okay. They are 1 rupee coin. But they are different. Okay. So similarly, iso-enzymes are also their function is same, but they are different. Okay. Iso-enzymes or they are also called as isozyme. Isozyme and iso-enzyme. Both are same terms. Okay. They are multiple forms, okay, of same enzyme that catalyzes the same biochemical reaction. Okay. Their function is same. They catalyze the same biochemical reaction, but they are different. In some way, they are different. Okay. Here, the other definition for this isoenzyme is different molecular forms of same enzyme. Different molecular forms of same enzyme synthesized from the various tissues. Okay. Various tissues. Okay. The same enzyme is synthesized in heart and other form of the same enzyme is synthesized from some other organ. So they are isozyme or they are iso-enzymes. So how they differ? Okay. This isoenzyme, multiple forms of the same enzyme, this will help in regulation of the enzyme activity. So one of the factors in regulation of the enzyme activity is isoenzyme because they are present in different isoforms. Many of the isoenzymes are tissue specific. Okay. One isoenzyme will be specific to the heart, other isoenzyme will be specific to the brain, other will be specific to the kidney. Because of the tissue of origin, they are different, but their action is same. Okay. They differ in their physical and chemical properties. Okay. Their physical property and chemical property will be different. Okay. And their structure, their Km value, their maximum velocity, pH for their action, electrophoretic mobility, okay, and carbohydrate content and susceptibility to inhibitor. Okay, how they are different? Okay, they catalyze the same reaction, but they are different with respect to the physical and chemical properties. Okay, they are different with respect to the physical, chemical properties. In that, their structure will be different, Km value will be different, P maximum, pH for their activity, electrophoretic mobility, okay, carbohydrate content, and susceptibility to inhibitor. Okay. One will be susceptible to one inhibitor. Other isoenzyme will be susceptible to some other inhibitor. Okay. So examples of isoenzyme are LDH. LDH is what? Lactate dehydrogenase. CPK is what? Creatine phosphokinase. Okay. So what is the method of separation or identification of the isoenzyme? It is mainly by the electrophoresis. Electrophoresis is a special technique that we are going to learn later. Now, why there is the existence of isoenzyme? Why isoenzymes are present in our body? Why not the same enzyme? Why different isoenzymes are present? See here, because they are synthesized from the different gene. Okay. The isoenzyme of the brain is different because here the gene is different. The isoenzyme which is present in the heart will be different because it is synthesized from some other gene. So there is a genetic difference. The genes for the synthesis of isoenzymes will be different. That's why they are different. Okay. See here the example, valent dehydrogenase of cytoplasm is different from that found in the mitochondria. Okay. In the cell also, if you take not only the tissue, in the cell, if they are present in the cytoplasm, that isoenzyme will be different from the isoenzyme of mitochondrial origin because they are synthesized from the different genes. Oligomeric enzyme consists of more than one type of subunit. Okay. The main unit Good afternoon. We are sorry for the inconvenience because of the electricity problem, but we can't help it. So, what is existence of different form of same enzyme? So, one we learned that they are synthesized from the different gene. And other reason for this is they are oligomeric. They are having more than one subunit. Okay. The main enzyme will be same only, but subunits which are attached to the main enzymes, that will be different. Okay, because of the different subunits, the enzyme exists in the isoenzyme form. Okay. So here you see rapid dehydrogenase has different subunits that we are going to learn in detail. Creatine phosphokinase also has three different subunits. So three different isoenzymes are present because of the presence of subunit. The other reason is the enzyme may be active as a monomer or oligomer. Okay. Some enzymes are present as a single enzyme. Some are oligomer. Means from the monomer, oligomer is derived. Okay. Some enzyme, same enzyme is present as is having two monomers. Okay. Dimer, it is present as a dimer. Some enzymes are present as a three units, as a tetramer. Some enzymes are present as a oligomer. Okay. So because of the presence of this monomer and oligomer, there is existence of isoenzyme form. Okay. So here one more reason for existence of the isoenzyme is because of the presence of carbohydrate content. Okay, in one isoenzyme, the carbohydrate content will be different when compared to the other isoenzymes. So because of the different carbohydrate content, there is existence of isoenzyme. But the main enzyme activity will be same. Okay. So here the example is alkaline phosphatase. Now coming to the different variants. So what is this true isoenzyme? Isoenzyme. There are two types. Okay. Then there is alloenzymes. Okay. Then isoforms. So we'll learn one by one. So what are true isoenzymes? True isoenzymes are the product of different genes. Okay. True isoenzymes are the product of different genes. They are derived from the different genes. They are true to their nature. Okay. See here, salivary amylase and pancreatic amylase. They are derived from the different genes. Okay. And the genes are also located on the different chromosomes. Genes are located on the different chromosomes. They are derived from the different genes. Okay. The example here is the salivary amylase. Salivary amylase is derived from the genes of a parotid gland. Okay. It is present in the saliva. Similarly, pancreatic amylase, it is derived from the genes of the pancreas. Okay. It is present in the pancreatic juice. But the action is same. They are having same action. But the tissue of origin, their genes are different. Coming to alloenzymes. Okay, this is very important Viva question. Alloenzymes. What are isoenzymes? What are alloenzymes? Okay. The examiners will be very fond of this term. What are alloenzymes? They will frequently see these examiners asking frequently alloenzymes. Okay. Here you see the enzymes arise from the same genetic loci. Okay. And if they exhibit structural variation among different individuals, they are derived or they are synthesized from the same genetic loci, but still they are different. Okay, the different individuals. They are called as allozymes. For example, here you see this glucose 6-phosphate dehydrogenase. It has 40 different allelic enzymes. Okay, it is derived. It is synthesized from the same loci, same genetic loci, but there are 400. Okay, there are 400 different isoenzymes of this glucose 6-phosphate dehydrogenase are identified. So, two isoenzymes, they are derived from the different genetic loci. Alloenzymes, the enzymes arise from the same genetic locus and they given here is the glucose 6-phosphate dehydrogenase. It has 40 different isoenzymes. Okay. Now coming to the isoforms. What are isoforms? Okay. Before that, you should have the knowledge of translation. What is translation? It is the mechanism by which the proteins are synthesized. Okay. Then post-translation means after the synthesis, modification. Okay. After the synthesis of the protein, there are some modifications that happens. Okay. For example, here trypsinogen. Okay. Trypsinogen, this trypsin enzyme, it is synthesized as a trypsinogen. Then after the synthesis, it undergoes post-translation modification, and it will get converted to proteolytic cleavage. Okay, this peptide, some part of this peptide chain will be broken. So it is converted from the trypsinogen to the trypsin. So this is called as post-translation modification. The modification which happens after the synthesis. So here also isoforms are produced because of the post-translation modification of the same polypeptide chain. Okay, and in a different ways to generate the different iso-enzymes. Okay, the enzyme synthesis are same, but after the synthesis they undergo some modification. Okay, they are called as isoforms, but their function will be same. Here you see salicylic acid contained in the alkaline phosphatase. Okay. The salicylic acid is a carbohydrate. Okay, the content of this will be different in different forms of the alkaline phosphatase. Okay. So you will understand better when I give you example. The most commonly given example is lactate dehydrogenase, LDH. That is commonly called as LDH. Okay, LDH is what? It is a lactate dehydrogenase. Okay. It is thoroughly investigated. See here, what is the systemic name of this lactate dehydrogenase? It is L-lactate, LAD, okay, oxidoreductase. And the name, the numbering of this isoenzyme is EC1127. Okay, if you want, you learn it, otherwise you can just take it. Okay. So this is the systemic name of the LDH. LDH is what? It is a lactate dehydrogenase. Okay. What is the normal level of this lactate dehydrogenase? It is, see here, 100 to 200 units per liter. 100 to 200 units per liter. Okay. And in the growing children, we see the high value. The values will be in the upper range. Okay. And the values also increase following the strenuous exercise. Following the heavy exercise, the levels of the LDH will go to the upper range. Okay. So what is the reaction catalyzed by this enzyme? Okay, lactate dehydrogenase, you might be knowing. Okay, it converts the pyruvate to the lactate. So pyruvate is the substrate for the lactate dehydrogenase. It is reduced to lactate. Okay, see here, 2 hydrogen molecules are added to this pyruvate. So it is reduced to the lactate. Okay. Here the enzyme is the lactate dehydrogenase, and the coenzyme, this NADH, it is called as coenzyme. The enzyme here is the lactate dehydrogenase, and the coenzyme is NAD. Okay. And the substrate is pyruvate. It is converted into lactate. Okay. See here, this LDH, it is present inside the RBC. The concentration of LDH, okay, it is 100 times more when compared to the concentration of this enzyme in the plasma. Okay. The LDH level is 100 times more inside the RBC when compared to the plasma. Therefore, if there is minor hemolysis, in the lab, the test result will give false positive. Okay. If there is minor hemolysis, all the LDH which is present inside the RBC will come out and it will give false positive result. Okay. So the concentration of LDH is more in the RBCs when compared to the plasma cell. Okay. In the plasma, and how much it is more? It is 100 times more. Okay. So we should not use hemolyzed sample for the estimation of the LDH level. Now coming to what is this LDH? Okay, we'll learn the structure. It is called as tetramer. Tetramer is what? It has 4 subunits. Okay. polypeptide chain in that forms 5 different combinations. M unit or M subunit is a basic one, and H subunit is a acidic one. Okay. Here we are learning the structure of the LDH. So LDH is a tetramer. It has a 4 subunits. Okay. It has either H or M type. H, the H subunit, it is mainly present in the heart. M subunit, it is mainly derived from the muscle. Okay. And M is the basic one, and H is the acidic one. Now you see here, okay, this is the plate, okay, agarose plate. Okay. And here we have applied the serum sample and run the electrophoresis. Because of the charges present on this enzyme, okay, there will be mobility in the electric field. Okay, this is the glass plate on which the agarose gel is applied. Okay, then here the point of origin. Here we have applied the serum. Okay, and this plate is kept in the electrophoretic machine. Okay, and switch on the current because these enzymes are charged molecules. They are protein in nature. They are charged molecules. They move in the electric field. Okay, and see here the mobility. LDH1 is the fastest one when compared to LDH2. Okay, then LDH3, LDH4, and LDH5. Okay, so this is the difference. Okay, on the electrophoresis, we can identify different isoenzymes of LDH. Okay. See here, at note there are 4 subunits. Okay. Here you see these green circles, they represent the M subunits, and this red circle they represent the S subunits. Okay. LDH1 has four M subunits. Okay. LDH2 has 3 M subunits and 1 H subunit. It's M3 and H1. Here M2 and H2. Okay. Here M1, H3, and LDH5 has all 4 H type of subunits. It is H4. Okay. So here M4, M3, H1. Here M2, H2. Here M1 and H3, and LDH5 has all 4 H type of subunits. So how these are different? So there are 5 subunits of LDH. LDH1, LDH2, LDH3, LDH4, and 5. So LDH, lactate dehydrogenase enzyme, has 5 subunits. They catalyze the same reaction, but they are different. Okay, when we see on the electrophoretic machine, okay, and they are also different because of the presence of different subunits. Here you see the composition, location, and what is the diagnostic importance of LDH. Okay. So I told there are 5 subunits of LDH. LDH1 has 4 H type of subunits, and they are originated from the heart and RBCs. They are synthesized in the heart and RBCs. They are useful for the diagnosis of myocardial infarction, and they constitute 30% of the total LDH. LDH2 has H3 and M1, 3 H subunits and M1. They are derived from the heart and RBCs. They are used. This isoenzyme is useful for the diagnosis of the megaloblastic anemia. It is useful for the diagnosis of the megaloblastic anemia, and it constitutes 35% of the total enzyme activity. Okay. LDH3 has H2 and M2 units, subunits. It is mainly derived from the brain, okay, and it is useful for the diagnosis of leukemia and malignancies, and it constitutes 20% of the total enzyme. Okay. LDH4, it has 1 H1 and M3 subunits, okay, mainly present in the lung and spleen, and this isoenzyme LDH4 is useful for the diagnosis of pulmonary infarction, okay, and it constitutes 10% of the total enzyme activity. Okay. LDH5 has all 4 M type of subunits, and it is mainly synthesized from the liver and muscle, and it is useful for the diagnosis of liver diseases, muscle diseases, okay, as the tissue of origin. Okay. So it is derived from the liver and muscle. So any disease in the liver or muscle, we can identify we can estimate the level of LDH. So it will indicate the severity of the disease. Okay. Now coming to the LDH and heart attack. So one of the important enzyme for the detection of the myocardial infarction is LDH. So total LDH level is increased in the blood with heart attack. But LDH1 isoenzyme is increased 5 to 10 times more than the normal level. Okay. Total enzyme activity is also increased, but LDH1 is very specific one in the heart attack. Okay. The concentration of which is increased 5 to 10 times in the normal level. Okay. It is called as flipped pattern. So what is this flipped pattern? Normally, LDH2 level in the blood is greater than LDH1. LDH2 is more compared to LDH1. Okay, but this pattern is reversed in the myocardial infarction, and this is called as flipped pattern. Means in myocardial infarction, LDH1 level will be more when compared to the LDH2 level. Okay, normally LDH2 level will be more when compared to LDH1 level, but in myocardial infarction, the level of the LDH1 is increased more when compared to the LDH2. So this pattern of increase in the concentration of LDH1 when compared to LDH2 is called as flipped pattern that is commonly seen in the myocardial infarction. So what is the specific one? Which isoenzyme of this LDH is specific for the myocardial infarction? It is LDH1. Okay. Coming to the significance of different catalytic activities. Okay. See here, this LDH1 has 4 S type of subunit. It is mainly present in the heart muscle. Okay. And the activity of this enzyme is inhibited by the pyruvate. Okay. In the heart muscle, if you see, pyruvate is converted into acetyl-CoA, which enters into the TCA cycle. Okay. The heart muscle, pyruvate is converted into acetyl-CoA and enters into the TCA cycle. But in the skeletal muscle, the isoenzyme present is LDH5. Okay. And the activity of this LDH5 is not inhibited by the pyruvate. Here the pyruvate is converted to lactate. So that is the difference. In the heart muscle, okay, this LDH1 is the activity of this is different when compared to the activity of this LDH5 in the skeletal muscle. And what is the other difference? LDH5 has low Km. Okay, I have told when I was teaching the Km value. Km value is inversely related to the enzyme affinity. Okay, if the Km value is high, the affinity of the enzyme to the substrate will be less. If the Km value is low, the affinity of the enzyme for the substrate will be high. So it is inversely related. LDH5 has low Km value. Its affinity of this LDH5 for the pyruvate is low. And LDH1 isoenzyme has high Km. It has this enzyme has no affinity for the pyruvate. This shows the different catalytic activity of H1, LDH1 and LDH5 in heart muscle and skeletal muscle. Now coming to the other isoenzyme. That is the creatine kinase. This is the other example of isoenzyme. See here, what is the function of this creatine kinase? What reaction it catalyzes? It catalyzes the creatine phosphate to creatine. Okay. When I was taking the practical of creatine estimation, I have told okay, what is the creatine? Okay, how this creatine phosphate is formed and where it is stored and all that. Okay. This creatine phosphate is converted into creatine by the creatine kinase. Here you see ADP is converted into ATP. Okay. Whenever we do the exercise, okay, this creatine phosphate is a high energy compound. Immediately it will get converted into creatine, and ADP will take up the phosphate to form the creatine phosphate, and it will get converted into ATP. So this is the immediate source of energy when we do the exercise. So this reaction is catalyzed by the enzyme creatine kinase. Okay. What is the normal level of this creatine CKF. It is a dimer. Okay. And it is made up of two subunits called as B. Okay. B stands for the tissue of origin, that is brain, and M stands for the tissue of origin, muscle. It has two subunits. It is a dimer. Here you see CK1. What are the isoenzyme form of creatine kinase? It is CK1, CK2, CK3. CK1 has subunits BB. Okay, like LDH had some H type of subunits, some M type of subunits. So this CK1 has BB type of subunits. Okay. So the tissue of origin for the CK1 is brain. So in the brain, CK1 is synthesized. And what are the subunits? BB. Okay. And this constitutes only 1% of the total enzyme activity. Okay. CK2. Okay. CK2 has subunits MB. One M subunit is there, one B subunit is there. And what is the tissue of origin? From where it is synthesized? It is synthesized in the heart muscles. Okay. And it constitutes 5% of the total enzyme activity. Okay. CK3, it has subunits M type. M. And the tissue of origin is skeletal muscles. Okay. And it constitutes 80% of the So we were talking about the isoenzyme form of creatine kinase. This creatine kinase has three forms of isoenzymes: CK1, CK2, and CK3. Okay. If you see the how they are different because of the different subunits present. Okay. In the CK1, the subunits are DB and mainly present in the brain. Okay. CK2, the subunits are MB, okay. And they are mainly present in the heart. Okay. And CK3, the subunits are MM type, okay. And mainly present in the skeletal muscle. So what is the significance or what is the use of studying this isoenzyme form? Okay, here you see in healthy individual if you see the level of CK2, yeah, this is also called as CPK. CPK is what? Creatine phosphokinase. MB type. Okay, it is undetectable, but the level is increased in case of myocardial infarction. So this is the enzyme used for the diagnosis of myocardial infarction. And the level of this start rising within 3 to 6 hours of event. See here, this is the early marker for the myocardial infarction. So the isoenzyme form of this creatine phosphokinase CKMB is normally not detectable, but the levels are increased in case of myocardial infarction, and the levels increase within 3 to 6 hours of the event. Okay. And this is very reliable indicator when compared to the other markers. It is a reliable marker for the diagnosis of myocardial infarction. Okay. Now coming to the CK and muscular dystrophy. Okay. Not only the myocardial infarction, the level of the creatine phosphokinase, because this is present, creatine kinase or creatine phosphate. It is present in the muscle. It is mainly stored in the muscle, and in the muscular dystrophies, the level of this creatine phosphokinase it is increased. Okay, and it is increased to 500 to 1,500 international units per liter. Okay. The levels are also increased in the crush injuries, in case of fracture and acute cerebral accidents. The total level of this, okay, not only the isoenzymes, the total level of the creatine kinase is estimated in the muscular dystrophies. So, okay, you see here, same thing, okay, CK1, it is mainly increased in the neurological injuries. Okay. CK2, it is mainly increased in the myocardial infarction. This is a marker for the myocardial infarction. CK2, or it is also called as CKMB. Okay. CK3 type of isoenzymes of creatine kinase. Okay, this is increased in case of muscular dystrophies and myopathies. Now coming to the alkaline phosphatase. The normal range for this is 40 to 125 units per liter. Okay, if you take the catalytic unit, okay, it is 3 to 30 units per liter. And there are 6 isoenzyme form of this alkaline phosphatase are present. Okay. And how they are different? These isoenzymes, earlier we have seen subunits were there. Okay. K type, P type of subunit was there. Then M type of subunit was there in the creatine kinase. But here the isoenzymes are different because of presence of different carbohydrate content. Okay. Here you see the 6 isoenzyme form of alkaline phosphatase. Okay. Here they have given the name alpha 1, alpha 2. Okay. In alpha 2 again, one is the heat labile, other is the heat stable one. And 3 beta, gamma, and leukocyte type A. Okay. So alpha 1 it is very present in the biliary cavity and it constitutes 10% of the total enzyme activity. Alpha 2, okay, and alpha 2 again 2 types are there. One is the heat labile, other is the heat stable. Okay. Heat labile one of alpha 2 is present in the hepatocytes and it constitutes 25% of the total enzyme activity. Okay. Alpha 2 is a heat stable one. It is mainly found in the placenta. Okay. And it constitutes 1% of the total enzyme activity. 3 beta is present in the bone. Beta name suggests it is present in the bone. Okay. And it is a major one. It constitutes 50% of the total ALP activity. Okay, gamma type, it is mainly present in the intestine and it constitutes 10% of the total activity. Leukocyte of ALP. Leukocyte, as the name suggests, this ALP isoenzyme is present in the or synthesized from the leukocyte and it constitutes 4% of the total enzyme activity. Okay. Coming to the normal range of the ALP. What is the normal range? It is 40 to 125 units per liter. Okay. And we can see the moderately increased, means 2 to 3 times the normal level. Okay. Moderately increased level of alkaline phosphatase is seen in the hepatic diseases like infective hepatitis, alcoholic hepatitis, or hepatocellular carcinoma. Okay. So moderately increased levels, 2 to 3 times the normal levels, are seen in the hepatic diseases like infective hepatitis, alcoholic hepatitis, and hepatocellular carcinoma. You see here, very high levels. Very high means 10 to 12 times than the normal levels are seen in the obstructive jaundice. Okay. Jaundice can be intrahepatic or extrahepatic type. In the obstructive jaundice, the level is increased to 10 to 12 times the normal level. Okay. And during obstruction, why there is increased level? Because during the obstruction, there will be irritation to the epithelial cells of the canaliculi of the biliary tract. Okay. Whenever there is infection to the biliary tract, the cells release the ALP. Okay. Because ALP is present in the biliary tract. Okay. So if there is infection to the biliary tract, this enzyme concentration will increase. Okay. Drastically increased levels of ALP are seen in the bone diseases. This is mainly because it is mainly because of the enhanced osteoblastic activity. Okay. Some ALPs, okay, they are present in the beta form. Okay, mainly beta form of the ALP is present in the bone. Okay, and it is major one. It constitutes 50% of the total enzyme activity. Okay, so whenever there is bone disease, okay, the levels of the ALP are drastically increased. That is 50 to 25 times the normal level. Okay, and we can see the increased levels in the bone diseases like Paget's disease, rickets, osteomalacia, osteoblastoma, then metastatic carcinoma of the bone, okay, all this. Coming to the other isoenzyme. So 3 isoenzymes already we have learned. That is, one is the ALP, then creatine kinase, then LDH. Okay. Fourth one is the alcohol dehydrogenase. It has 2 heterodimers. Okay. 2 types are there here isoenzyme. Alpha beta 1, alpha beta 2. Alpha beta 1, it is mainly seen in the white Americans and Europeans. Okay. Whereas this alpha beta 2 form, it is mainly seen in the Japanese and Chinese. Okay. This alpha beta 2, it rapidly converts the alcohol to acetaldehyde. Okay. What is the difference between these two? Okay. One is the where they are present, in which country they are mainly seen. This alpha beta 1 isoenzymes are mainly seen in the Americans and Europeans, whereas alpha beta 2 isoform of this alcohol dehydrogenase is seen in the Japanese and Chinese. So how they are different? One more difference is that this alpha beta 2 type, it rapidly converts the alcohol to acetaldehyde. Whenever there is increased acetaldehyde, whenever the person consumes the alcohol, all the alcohol is converted into acetaldehyde. Whenever there is increased acetaldehyde, what will happen? You see here, it is associated with the tachycardia. Okay, tachycardia is what? Increased heart rate. Okay, then facial flushing, increased blood supply to the face. Okay, which is not commonly seen in the whites. Not commonly seen in the Americans and Europeans. So Japanese and Chinese, they have increased sensitivity to alcohol consumption. It is mainly because they have the alpha beta 2 type of alcohol dehydrogenase isoenzyme. Hope you have understood. Now coming to the applications of this isoenzymes. They are therapeutic agents, means they can be used as a drugs for the treatment. Okay. Analytical means for the estimation, genetic engineering and industrial application. So, what are the therapeutic applications of these enzymes? Okay, here you see the enzyme, okay, streptokinase. Streptokinase is given as a drug. Okay, so this streptokinase, what is the use of this streptokinase? It clears the blood clot. Okay, so in the clotting system, what is the end product? How the clot is formed? It is mainly because of the formation of the fibrin. What is clot? It is a fibrin. Okay. In the clotting system, you see ultimately the last product fibrinogen is converted into fibrin. This fibrin forms the clot. Okay. But this clot, okay, it can obstruct the blood supply. So we have to clear. Okay. In the body, there is adequate mechanism to clear the blood clot. But in some patients, okay, we have to supplement. We have to give some drugs which clears the blood clot. Okay. Here, the enzyme, you see what is the action of this enzyme, streptokinase. Okay, it is derived from the bacteria Streptococcus. Okay, it clears the blood clot. Whenever there is formation of the blood clot, it clears because it can block the smaller arteries and there can be compromise in the blood supply. Okay, mainly in the heart. Okay. So, what is the function of this streptokinase? Streptokinase converts the plasminogen to plasmin. Okay. This plasmin converts the fibrin clot to soluble products. Soluble products are easily excreted. Okay. So, this streptokinase, okay, enzyme, okay, in the form of drug, it is used in the myocardial infarction to clear the small clots formed in the small blood vessels, which supplies the heart. Next, coming to the asparginase. Asparginase is an enzyme, okay, which converts the aspargine amino acid to aspartate. Okay. So now, what is the use of this aspargine? Aspargine, you know, it is an amino acid. Okay. So this aspargine amino acid is required for the multiplication of the cell. This asparginase converts the aspargine inside our body to aspartate. Now this aspartate crosses the plasma membrane. This is the cell. Okay, this is the cell. Only aspartate can cross, not aspargine. Okay, if the aspargine has to go inside the cell, okay, first it will get converted into aspartate. Aspartate will cross the plasma membrane and enters the cell. In the cell, it is required for the multiplication of the cell. Okay. Now you see. Okay, this asparginase enzyme is used in the leukemias. In the leukemias, what will happen? There will be uncontrolled multiplication of the cells. So we have to stop. Okay, for the multiplication of the cell, what is required? Aspargine is required. So we have to make the cell deprived of the aspargine. So how to make? Okay, we have to give the asparginase. Okay, so we have to block the conversion of this aspargine to aspartate. We have to block the conversion of this aspargine to aspartate. Now it will not enter into the cell and there will not be any multiplication inside the cell. So we have to give the asparginase. Okay. So asparginase will convert all the aspargine in the blood to aspartate. Okay. So it will not allow the aspartate to enter into the cell. Okay. So inside the aspartate will not enter into the cell and there will not be any multiplication. So we have to give this enzyme as a drug in case of leukemias. Okay. Now coming to the other uses of these enzymes. Okay. In the lysosomal storage disorders. Okay. In the I think previous years, Ms. Nilisha has taught you lysosomal storage disorders. Okay. Pouch's disease, Pom's disease, Fabry's disease. Okay. These diseases are because of the deficiency of the enzymes. Okay. You see here. Okay. In the Gaucher's disease, there will be deficiency of glucosidase enzyme, beta glucosidase enzyme. Okay. In the Pom's disease, there is deficiency of alpha glucosidase enzyme. Okay. In the Fabry's disease, is because of the deficiency of enzyme alpha galactosidase. Okay. We can supplement this enzyme in the form of drugs, and we can treat the lysosomal storage diseases. Okay. Many diseases are because of the deficiency of enzymes. So we can supplement the enzymes in the form of drugs and we can cure the diseases. So So these are the therapeutic uses. Okay, here you see streptokinase, urokinase are used to remove the blood clot. So they are very useful in the myocardial infarction. Asparginase is used in the cancer therapy. Okay, papain. Okay, papain is a enzyme which is used as an anti-inflammatory. Okay, alpha-1 antitrypsin. Already I have taught you. Okay, in the emphysema there will be alpha-1 antitrypsin deficiency. This alpha-1 antitrypsin acts as an enzyme and it is used in the treatment of emphysema. Pancreatic enzymes like trypsin and lipase, they are used whenever there is indigestion. Okay, and in case of pancreatitis, they are used. So these are the therapeutic uses of enzymes. Enzymes are used as a drug for the treatment of the diseases. Now coming to the enzyme as an analytical reagents. Okay, certain enzymes are used. I think I will continue in the next class. Okay, analytical uses, right? Immobilized enzymes, okay, and applications of genetic engineering and industrial application. I will take in the next class. Try to read whatever I have taught so you will understand better. Thank you.